Hello friends. Uh, Till now we have discussed about the mnemonics and history taking part of step 2 CS examination followed by detailed history taking. Now I'm going to describe about uh, gen specific system wise and history taking. First, I'll be going to OB-GYN, obstetrics and gynetics. And here we follow the mnemonic, most common used mnemonic is LMP, RT, CVS, PAP. I'll describe in the next slide. And you also ask for the vaginal discharge. When they say yes, you can go and ask ABCO, the same amount, blood, color, odor. And you ask for the itching. And then vaginal dryness. And you ask for breast fullness, tenderness, discharge. These are all specific if you suspect any if the patient is pregnancy if you suspect pregnancy or lactating female, then you can ask these. And hot flushes, it's useful in perimenopausal patient or menopause patients. Diagnosis you will get. And you'll get to know in LMP, CVS, pregnancy, abortions, by that way delivery, if they had any postpartum hemorrhage. If yes, you can ask for blood transfusions, and whether they were able to lactate or not. If they were not saying, if they say no, you can suspect Sheehan syndrome in that case. And to describe LMP, CVS, PAP, you can ask the L stands for last menstrual period. If it is, if it is more than, and you can suspect a pregnancy more than 4 weeks. If they say 6 weeks. And you can also ask for whether cycles are regular or not to suspect pregnancy. Okay. And menarche, you can ask pain during menses or intercourse or defecation, regular cycles, T for tampons number used during heavy day, and CVS, crampy pains, vaginal discharge, spotting, PAP, pregnancy, abortion, pap smear, when it is done, and result. Alright. And screening tests this have already discussed: PMDC, pap smear, mammography, uh, DEXA scan, colonoscopy. Alright. And in detail I'll go for a CVS examination. Whenever if it's not examination, CVS part, if you want other history taking part other than the chief complaint, you just remember these: um, chest pain, palpitations, SOB, orthopnea, PND, pedal edema. If they say cough, you can ask for ABCO, again amount, blood, color, odor. Cough pain, if they say yes, you ask for OCP use. Can suspect pulmonary embolism or DVT in these patients. And exposure to radiation chemotherapy, you can ask for pulmonary fibrosis or something like that. And next, going to in detail dyspnea, if there is a chief complaint, how to ask. You can ask like whether it's exertional or when during rest. You can classify the gradings. You can know that grade 3 exertional. If it is also rest, it is grade 4. You can say orthopnea also present. And exercise capacity, you can ask whether it's reduced or not. If it is reduced, to how many blocks, you can ask how many blocks he can walk. What is his capacity, you can ask. And this, and you can ask for relation of dyspnea with day timings, that's during the day or night, you can ask. And you and also ask about this use, whether he uses more pillows at night to sleep. And palmar erythema, you can ask for it also covers in the rash aspect of history taking. And then coming to sore throat, you can ask like throat pain, do you have any throat pain, do you clear your throat often? Odenophagia, pain during the swallowing, drooling, postnasal dribbling, hoarseness, voice, facial pain, cervical lymphadenopathy, any, do you have any, do you feel any lumps in your neck or something like that? You can ask like that. And specifically GI symptoms, you can ask like heartburn, metallic taste, NSAID intake, you can suspect peptic ulcers, jaundice, yellowness of eye, skin, like that you can ask. Abdominal distension, pain, bloating, relation of pain with food, milk, wheat. Milk, you can suspect relation of not only pain, diarrhea or something. If it is with milk lactose intolerance, you can say wheat specific, food specific pain. You can say with peptic ulcer, with the gastric ulcer, the pain increases with food intake. With the urinal ulcer, the pain decreases with food intake. Like that way, you can differentiate the DDs. And dysphagia, you can say, you can ask for whether it's at the beginning of intake, food intake, middle, or at the end. And difficulty in swallowing is whether it's for solids or liquids or both. In that way, you can suspect if it is for liquids, solids, whether it's cancer, esophageal cancer, or echalalia cardia, you can differentiate. And odonophagia, you can ask. Coming to musculoskeletal examination, as I told, WNT, WRS is weakness, numbness, tingling, warmth, redness, stiffness, and swelling. And you can ask for other joint involvement, any change in the gait, and recent overuse, lifting heavy weights, popping um, sounds, clicking sound, crepiters, locking of joint. You can ask for the history of chickenpox. Mainly, you can ask in case of back pain. If you suspect any Hesper's Schuster like that, you can shingles. So you can ask that in case of back pain. And coming to CNS, we'll discuss in the next session. Hope you enjoyed this video. Thank you.